Danita Wapusian calls North Central Regina home. It's where she injected drugs for years and where she contracted HIV. Unlike other parts of Canada, injection drug use is the primary source of HIV transmission in Saskatchewan.
I did drugs with my daughter, my sister, my brother, my nieces, nephews, and that's the way it is in this community.
This frontline agency handed out 1.4 million clean needles to drug users last year, but when the pandemic hit, it had to halt all testing at this location.
To tell them, go here, go there for testing, that doesn't work because they feel they're just not comfortable. So they're slipping through the cracks.
Across the province, public health nurses have been diverted to COVID-19 testing, contact tracing, and vaccinations. In 2019, the provincial lab processed nearly 94,000 HIV tests. But during the pandemic, testing plummeted by 30%.
The fact that we have a relatively similar number of cases and actually slightly higher cases here in Regina, and the fact that there's been such a significant decrease in testing means that there's lots of people who are undiagnosed, who aren't accessing testing and services.
Dr. Alex Wong says HIV infections are the result of other chronic problems, including homelessness, mental illness, and addiction.
It's going to be something that we're going to play catch up with probably for years, unfortunately.
The head of the Canadian Aboriginal AIDS Network says it disproportionately affects Indigenous people.
This land called Canada, it's developed. We're supposed to not have these diseases, and we're supposed to not have people die of AIDS, but yet we do.
If you know your status, you can take care of yourself better, right?
Public health experts who work for the Saskatchewan Health Authority say they're also torn. In the midst of a pandemic, resources are quite simply stretched to the limit. Bonnie Allen, CBC News, Regina.